Everyone's lives changed in the blink of an eye a year ago.
Frankie Millington is an essential worker who is working through his anxiety, depression, and eating disorder. Over a year, he's felt the strain the pandemic has had on his mental health.
My panic attacks started to increase a lot, and then that would just send me into bouts of like depression where I would just lay catatonic in my bed for like 5 hours.
Samantha Khalil gave up after nearly a year of isolating from others and went to a birthday party. She got COVID-19.
Everyone's going to look at each other and be like, shame on you. You knew better. But we all know better. Yeah, we still desire that connection.
These two are by no means alone. Millions of people have felt some pandemic stress at some point since March 2020.
I could feel the stress of everything getting to me.
I'm willing to try anything just to feel like me again.
A little bit worried that, does this become the norm?
A new report from the American Psychological Association looks at stress in America as we hit a year into the novel coronavirus pandemic, and it's showing up in the ways we're coping. The majority of adults, 61%, experienced undesired weight changes, weight gain or loss, since the pandemic started, gaining an average of 29 pounds. 2 in 3, 67%, said they had been sleeping less or more than desired since the pandemic started. And nearly 1 in 4 adults, 23%, reported drinking more alcohol to cope with their stress.
The advice just isn't getting through, and people have reached this moment of fatigue where they really have lost that ability to identify what's stressful for them and how to manage it in a more appropriate way.
Vale Wright with the American Psychological Association says the groups reporting some of the highest levels of problematic coping are those that are already really vulnerable.
Essential workers, including frontline workers, parents, as I mentioned, with children under the age of 18, young adults, as well as individuals from communities of color.
We also need to think about the long-term impacts of the pandemic on not only the mental health of kids, but also in terms of their social and emotional development.
Experts say people without stable housing, access to food, or money for their bills will suffer mentally without systemic help, but that it more or less comes down to getting people therapies in places where they need them, like school, work, churches. And that's going to be an issue long after the pandemic.
If this pattern continues without a change, then what we could really see are some pretty significant long-term physical and mental health consequences for many years to come.
Lindsay Thies, Newsy, San Francisco.